The MRCS Part A exam. Just hearing those words can send a shiver down the spine of any aspiring surgeon. This is not just another test. It's a defining moment, a milestone that stands between you and your dream of entering the world of surgery. It's a crucial hurdle on your path to becoming a surgeon, a gateway that demands not only your knowledge but also your determination and resilience. Every candidate who walks these hospital corridors knows the weight of what's at stake. The MRCS Part A is a test of knowledge, a test of your dedication, and honestly, a test of your nerves. The pressure is real. The long nights, the endless revision, the constant self-doubt, it all builds up to this one exam. You're not alone if you feel overwhelmed. In fact, almost every candidate feels the same way at some point. The anxiety, the uncertainty, the fear of the unknown, it's all part of the journey. Many aspiring surgeons share the same anxieties. Will I remember everything I've studied? Will my mind go blank when I need it most? These are common worries, and they're nothing to be ashamed of. What if I freeze up? What if I fail? These thoughts can be paralyzing, but remember, every great surgeon has faced them. Take a deep breath. You are stronger than you think, and you are not alone in this struggle. It's time to conquer those fears and approach the MRCs with confidence. Believe in your preparation, trust your hard work, and know that you have what it takes to succeed. How? Well, with the right tools and the right guidance, you can transform your anxiety into a powerful force for success. Remember, every challenge you overcome now is shaping you into the surgeon you aspire to be. The journey is tough, but you are tougher. Meet your new secret weapon. Hacking MRCS exam, Part A, Mastering MCQs. One by Dr. Atef Ahmed. This isn't just another textbook. This book is a comprehensive guide designed to help you not only pass but excel in your MRCS Part A exam. Dr. Ahmed, an experienced surgeon and dedicated educator, understands the challenges you face. He has crafted this book to address your needs directly. Hacking MRCs will be your trusted companion every step of the way. The MRCS Part A exam is known for its vast syllabus. Hacking MRCs tackles this head-on with over 2,000 meticulously crafted practice questions. This is not about quantity, it's about quality. Each question is designed to test your understanding of key surgical concepts across all syllabus topics. No more feeling lost or unsure. Hacking MRCS ensures you're fully prepared for whatever the exam throws your way. Simply memorizing facts won't cut it in the MRCS exam or in the operating room. Hacking MRCS goes beyond rote learning. It teaches you the critical skill of clinical thinking. Dr. Ahmed's clear explanations and clinical insights help you connect the dots between theory and practice. You'll learn to analyze scenarios, apply your knowledge, and make sound surgical decisions just like a real surgeon. Multiple choice questions can be tricky. Hacking MRCS equips you with proven strategies to approach them effectively. You'll learn how to identify keywords, eliminate distractors, and choose the best answer, even when you're unsure. These techniques are not about guessing. They're about maximizing your chances of success by approaching each question with a clear and strategic mindset. Hacking MRCs really brings the exam to life with realistic clinical scenarios. These scenarios go way beyond simple questions. They actually simulate the challenges you'll face as a surgeon. You'll learn how to apply your knowledge in practical situations, analyze patient presentations, and make informed decisions. This is honestly the bridge between theory and practice, getting you ready for the real world of surgery. Knowing your strengths and weaknesses is absolutely crucial for effective study. Hacking MRCS includes self-assessment tools and progress trackers to keep you on track. Make sure to regularly assess your understanding, identify areas that need more focus, and adjust your study plan accordingly. This personalized approach really ensures you're always making the most of your study time. Ready to put your knowledge to the test? Whether you're preparing for the MRCS or simply want to challenge yourself, practicing with sample MCQs is one of the most effective ways to reinforce your learning and identify areas that need improvement. Let's dive into a set of carefully selected questions designed to mirror the real exam experience and help you sharpen your clinical reasoning. Here are 5 sample MCQs from Hacking MRCS to give you a taste of what to expect. Each question is crafted to test not just your memory, but your ability to apply knowledge in practical scenarios, just like you'll need to do in the exam and in real clinical practice. Let's start with question number 1. Which of the following is the most common site for a femoral hernia? Take a moment to think about the anatomy of the femoral canal and its surrounding structures, as this is a classic question that often appears in surgical exams. A. Lateral to the femoral vein. B. Medial to the femoral vein. C. Anterior to the femoral artery. D. Posterior to the femoral artery. The answer is B. Medial to the femoral vein. This is a key anatomical relationship to remember, as it helps distinguish femoral hernias from other types of groin hernias. Femoral hernias typically protrude through the femoral canal, which is located medial to the femoral vein. This anatomical detail is crucial for both diagnosis and surgical management, as femoral hernias are more likely to become incarcerated or strangulated due to the narrow neck of the femoral canal. Remember, understanding the spatial relationships in the groin region can help you avoid common pitfalls in both exams and clinical practice. Moving on to number 2. A 25-year-old man presents with a painful lump in his right groin. This scenario is a classic presentation you'll encounter both in exams and in real life, so pay close attention to the details. The lump is tender and irreducible. These features are important clues that help narrow down the diagnosis. Which of the following is the most likely diagnosis? A. Inguinal hernia. B. Femoral hernia. C. Testicular torsion. D. Epididymo-orchitis. Think about the patient's age, the location of the lump, and the clinical features described. The answer is A. Inguinal hernia. Inguinal hernias are the most common type of hernia in young men, and a tender, irreducible lump in the groin is highly suggestive of this diagnosis. The patient's age, the location of the lump, and the fact that it's tender and irreducible are all suggestive of an inguinal hernia. Inguinal hernias often present with pain and swelling, especially if they become incarcerated. Always consider the possibility of strangulation if the lump is acutely tender and cannot be reduced, as this is a surgical emergency. Now let's tackle question number 3. Which of the following is the most important initial investigation for a patient with suspected acute appendicitis? A. Abdominal X-ray. B. Ultrasound scan. C. CT scan. D. Clinical examination. This question tests your understanding of the diagnostic approach to acute abdominal pain. The answer is D. Clinical examination. While imaging can be useful, the initial and most critical step is a thorough clinical assessment. While imaging studies can be helpful, the clinical examination, including history and physical exam, is the most important initial step in diagnosing acute appendicitis. A careful history and examination can often provide enough information to make a provisional diagnosis and guide further management. Remember, over-reliance on imaging can delay treatment in urgent cases. Let's move to question 4. Which of the following is the most common type of breast cancer? A. Invasive ductal carcinoma. B. Invasive lobular carcinoma. C. Ductal carcinoma in situ. D. Lobular carcinoma in situ. This is a high-yield topic, as breast cancer is one of the most common malignancies encountered in clinical practice. The answer is A. Invasive ductal carcinoma. This is by far the most common type, accounting for about 70 to 80% of all breast cancers. This type of breast cancer starts in the milk ducts of the breast and then spreads to nearby tissue. Recognizing the different types of breast cancer is essential for diagnosis, treatment planning, and patient counseling. Invasive ductal carcinoma often presents as a hard, irregular mass on examination and may be associated with skin changes or nipple retraction. Finally, question 5. Which of the following is the most common complication after a laparoscopic cholecystectomy? A. Bile duct injury. B. Bleeding. C. Wound infection. D. Pneumonia. Complications are a key area of focus in surgical exams, so make sure you know the most frequent and the most serious ones. The answer is B. Bleeding. While bile duct injury is a feared complication due to its severity, bleeding is actually more common in practice. While bile duct injury is a serious complication, bleeding is actually more common after laparoscopic cholecystectomy. It's important to be aware of both the frequency and the potential severity of complications, as this knowledge will help you anticipate, recognize, and manage them effectively in your surgical career. Practicing questions like these not only prepares you for exams, but also builds the clinical judgment you'll need every day as a doctor. Dr. Atef Ahmed is not just an author, he's an experienced surgeon with years of hands-on practice in the operating room. His journey in medicine has been defined by a deep commitment to patient care, surgical excellence, and a passion for teaching the next generation of doctors. Dr. Ahmed's expertise extends far beyond the pages of a textbook. He brings real-world experience and a compassionate approach to everything he does. As a dedicated educator, Dr. Ahmed truly understands the unique challenges and high standards of the MRCS exam. He has spent countless hours guiding students through complex surgical concepts, breaking down difficult topics, and helping them build the confidence they need to succeed. His teaching style is approachable, supportive, and always focused on practical understanding. Beyond his role as a surgeon and educator, Dr. Ahmed is a mentor who genuinely cares about the success of his students. He offers invaluable insights, practical tips, and personal guidance that can make all the difference on your journey to becoming a surgeon. His mentorship is a source of inspiration and motivation for aspiring doctors everywhere. With Hacking MRCS, you're not just getting a comprehensive study guide, you're gaining a mentor who is deeply invested in your growth and achievement. Dr. Ahmed's book is filled with strategies, exam techniques, and real-life advice that reflect his years of experience and dedication to student success. Don't leave your future to chance. Equip yourself with the knowledge, skills, and confidence you need to ace the MRCS Part A exam. With Dr. Ahmed's guidance, you'll be prepared to tackle even the toughest questions and stand out among your peers. Take the first step toward a rewarding surgical career. Hacking MRCS is more than just a book. It's your key to unlocking your full potential and achieving your dreams in the world of surgery.